More and more people are aware of these risk factors now, but I want to quickly go through some of these again. Heart disease is the #1 cause of death in women. Stroke is the 3rd most common cause of death in women. Cancer is 2. What I want to also talk about is the symptoms of heart attack and stroke, and then knowing your numbers. What to look for as far as numbers when you talk to your doctor or when you look at your healthcare profile to see whether you're where you need to be to try to stay away from people like me. Cardiovascular disease mortality trends have gone down. Women are on the red line and are going down about the same rate as men, but women still die from heart disease more often than men do, despite the fact there is a lot more heart disease in men than women. This is a chart showing the major causes of death in females. The pointer's not working. This is cancer. This is CLRD is lung-related diseases, COPD, emphysema, chronic bronchitis, and so you can see, heart disease is in the red. If you add stroke, and then you add other cardiovascular disease for all ages, it affects more women, much more than cancer and other related diseases. And as you go up in the age bracket, if you separate it between age 85 and below 85 and above 85, it's still, even though less than 85, the cancer gets pretty close to cardiovascular disease. As you get older, heart disease takes over. So basically what I'm trying to get here is a lot of women aren't aware of this fact. If you go back to 97, at least in this study, only 30% of women were aware that heart disease was a leading cause of death. And awareness is also lower in African American and Hispanic women, who are even at more risk for heart disease than Caucasian women. The mortality rate means the chance of dying. In the first year after a heart attack, men have a 25% mortality rate. Women have a 38% mortality rate. Women have a low, intermediate, or high risk for heart disease or heart attack depending on their risk factors, and we're going to talk about those. Depending on the level of risk, more aggressive risk reduction strategies are necessary. And we'll talk about this in a minute too. The more things about you that put you at higher risk for heart disease, the more aggressive we need to be and you need to be to try to reduce what you can reduce. There are a variety of risk factors for heart disease. Some of them are modifiable or controllable, some of them aren't. The ones that we can't do anything about is our age. Family history. If you have a family history of heart disease, you have it. There's nothing you can do about it. The same with your gender. So those are things that as you get older, the risk gets higher. If you have a family history of heart disease, the risk is higher. And then, as I said earlier, men tend to have heart disease earlier, women tend to have it later, but women tend to do less well with the recovery from heart disease, partly because they get it later in life. They're older, there are other things that can occur. High blood pressure. More men than women have high blood pressure until you reach age 55. Person who has normal blood pressure at age 55 has a 90% chance of developing high blood pressure later in life. So just because your pressure was normal in middle age doesn't mean you're not going to get it later in life. High blood pressure is a silent killer. A lot of times we think that high blood pressure, you feel bad when you have it. You don't. We see people that feel great. We do screenings in malls and areas. Their blood pressure be 180, 190. They feel fine. And people start to feel not fine when we treat it because medicines have side effects. But high blood pressure, just because you feel good doesn't mean your pressure is normal. Most of the time, it's going to be silent. Lowering blood pressure reduces your chance of a stroke by 40%, 30 to 40%, heart attack by 20 to 25%, and heart failure, whereas the heart is not pumping efficiently. High blood pressure is a big cause of that, and keeping your pressure within guidelines will help prevent all of these things. Here are the goals. Optimal blood pressure is a pressure less than 120 over 80. Most of us talk about 120 over 60. That's what most of our pressures were when we were kids. So the goal is 130/80, and this sort of lists the other ranges of blood pressure. But if yours is consistently above 130/80 in a relaxed setting, we need to do something about it. And one big one is weight reduction, body mass index. If you can keep your body mass index down in the high teens or mid-20s, low 20s, it can drop your blood pressure by about 5 to 20 millimeters of mercury. The DASH diet, which is fruit, vegetables, low salt, less fat, can lower your pressure significantly. Sodium restrictions. Some of us are more sensitive to salt than others. But what I usually tell my patients is try to keep your salt less than 2,000 milligrams or 2 grams of sodium a day. Physical activity, 30 minutes of exercise 3 or 4 times a week. And this is nothing, it's whatever you'll do, but it should be continuous, not, you know, like my excuse is I go back to the hospital back and forth, but I stop and start, and that doesn't count. It really should be something that you're just, this is my time to exercise. It helps burn calories, it helps to reduce weight, it helps reduce stress. Alcohol. A glass of wine a day, is, if you drink, is probably not a big problem. More than that, it does raise your pressure. And if you have real high, hard to control blood pressure, you probably should limit your alcohol as much as possible. Know your numbers. Now, we used to always talk about this, be less than 200. I tend to talk to my patients about knowing what their bad cholesterol is, and that's the LDL. The goal is to get that less than 100, especially if you have heart disease. The triglycerides should be less than 150. Now, triglycerides can be affected by a number of things. If you have diabetes that's not in great control, that can make that number 300-400. So sometimes a high triglycerides doesn't necessarily mean you're eating bad. It just means that maybe your diabetes isn't the best control. HDL, greater than 50. And a lot of people ask me, well, mine's only 30. How do I get it there? The best way to get it there is to have different parents, you know, and because it's an inherited thing. But the higher, the better. 50 is better than 40. 70 is greater than 50. Diabetes is a big risk factor for heart disease. Type 2 diabetes, or adult, it used to be called adult onset diabetes, has increased 50% in the last few years. Large of that's due to being overweight. People get diabetes late in life. This is out of your teenage years. Now some of it's genetic, but a lot of it is being overweight. And if you can keep your weight low, you tend to have less diabetes as an adult. Optimal, and what is diabetes? You know, optimal fasting blood sugar means you haven't eaten since dinner the night before. When you go in and get it drawn, it should be less than 100. You know, pre-diabetes, 100 to 125 fasting. And then if it's above 125, you probably need evaluated by somebody that knows about diabetes and can check. But fasting blood sugar less than 100 is roughly what you should keep in mind. People who are at risk for diabetes who follow a diet and exercise can decrease their risks of developing diabetes by more than 50%. Smoking, I won't spend a lot of time on that. Don't smoke. If you smoke, your risk of heart disease goes up dramatically. Arteries, I'm talking about stroke, blockages here, in your heart, and in your legs. So if you use tobacco or smoke, try your best to stop, because it's very preventable, it's bad for your lungs, and it's bad for your heart. And I tell a lot of my patients, at least the heart, sometimes we can fix it. If you get emphysema, we got nothing. So don't smoke. A study of women that never smoked, it shows their obesity and coronary artery disease mortality. The farther you go to the right, the more likely you are to have heart disease. And the more you smoke, the heavier you are, the more likely you're going to see me. Reducing calories will reduce the chance of getting overweight. Most of this we know, choose fat-free over whole milk, walk, park far, but walking. 2,000 steps equals a mile, roughly, and when you eat out, don't eat as much. Restaurants give us way too much food, and we tend to eat it because we paid for it, but it can count for lunch tomorrow. The more risk factors you have, the more likely you are to have heart disease. So if you have one, don't get a second one, don't get a third one. Try to reduce what you can. You can see the risk of heart disease goes up as you add things. Hormone replacement therapy, I won't talk about too much. A lot of older women have osteoporosis or postmenopausal. Hormone replacement therapy can reduce some of these things, but it also puts you at risk for cardiovascular disease. I don't necessarily prescribe it. Doesn't mean that it's wrong to take them. If you're already on it, doing well, don't have heart disease, don't stop it, but talk to your, think about it before you go on it. And I'm not the expert in this. I refer all my patients to their gynecologist or their primary doctor. But certainly if you take hormone therapy replacement, don't smoke. It really puts you at risk. Exercise, exercise, exercise. Helps everything. And it doesn't have to be super, just walk. Or walk in water if you've got bad legs or bad knees. Symptoms of a heart attack, and then I'll stop because I know I'm running very late. Symptoms of a heart attack are fullness in your chest, pain in your chest, sometimes goes down your arm, sometimes shortness of breath, sometimes nausea and vomiting, but sometimes it's none of these. So if something seems odd, make sure you ask your doctor. Women tend to feel things differently than men sometimes. And I think we feel the same thing, but we describe it differently. So I think some of it's cultural, some of it's maybe the way we're made. But if you have chest pressure, fullness, mailbox seems farther away than it was last month, there's probably something wrong. Quicker the better. So if you have those, call for help. Stroke, numbness in your face or your arm, all of a sudden can't speak, can't say words, have a sudden severe headache that just comes on, more severe than you've ever had before. These are all signs of a stroke. That doesn't mean every headache's a stroke, but just a real bad one with visual changes, speech problems. Don't wait. Call 911. Like I said, stroke is a brain attack. Quickness. We can reduce the damage of stroke with blood clot reducers now, but you got to get there within 3 hours at the most. These, and I meant to print off, these are some places you can go to get more information.